Good to have you with us on this edition of the Urban Debate. I'm Tanvi Shukla, and before we get you nationwide updates on coronavirus, there is one issue, viewers, that I want to address on top of this show. This whole entire nation got together, not once, but twice. Twice, on two different Sundays, we came together, once to Tali Bajao and then Diya Jalao, in a show of strength and solidarity towards our corona warriors. But it is unfortunate that while we do all of that, while we do all the drama and the theatrics and the symbolic gestures, on ground, we fail to pay the respect and support our healthcare workers or even our policemen. So while in TV studios, we've got people every day coming and appreciating the doctors and the nurses and the work that they're doing, we've been flooded with phone calls, while the top ministers have been calling them a version of gods and that we should give them the respect. You know what we're actually doing? We're harassing them. We are ostracizing them from our societies. We are isolating them. In some cases, we are even abusing and attacking them. Yes. This is the reality, and I would say shame on us. Shame on us for being that society that begins to target the very people who will save us if tomorrow you or I get coronavirus. Why? Because we fear that they may have the infection. So why can't we just stay indoors? Why can't we just stay inside our own houses and follow the lockdown like it's meant to be, instead of targeting the ones who are our saviors? Tonight, that's all we want to focus on in the beginning. And I will not have any other expert on this conversation. I will not have any government representative or a citizen representative. I only have representatives of the medical fraternity. These are the voices you need to hear and understand and support them. That's all that I am going to do tonight to begin with on this edition of the Urban Debate. So let's go across to Mrs. G.K. Khurana, General Secretary, All India Government Nurses Federation, and Dr. Kulsaurabh Kaushik, Joint Secretary and Spokesperson for FORDA. These are the two guests who will be joining us right now. Mrs. Khurana, good evening. Thank you for speaking to us. Can you give us an insight into what's the kind of trouble and problems that nurses in our country have been facing?
Yes, I've been working for the Nurses Federation for more than 40 years now. I said that our people, not the government, our people don't have any respect for the nurses. So that's why many nurses have gone abroad because they are not here. And now, when this coronavirus, even before coronavirus, when we are working in the hospital, when we are working in the ward, the patients are serious, they said you are everything. But once they go out of the hospital, they don't recognize our services. That is a bad luck profession, I can say. We have worked very hard to bring the problem sort of the profession so that people respect. I think now at the we have emergency and our day and night, they can't go home. They are monetized, they are away from their children, they are away from their family, and even then they go sometime, they said if they are on rent, long landlord will say you get the house and go somewhere. So see the pity on profession and the people whom we are serving, we are saving their lives. Not everybody is dying. We have saved many people. Not in the India, whole of the world, many people have been saved. The people are saying that people have been covered. These people have only 2% died or 10% died, but 90% people are saved because the care of the doctors and nurses. I think it is really shameful for us, as you said in the beginning, that it is shame on our people don't respect profession. Only Tani Bajao and this Diya Jalao is unless they are clear at their heart and they really respect us. That is I want to say that, but still, we have taken oath to serve the people, and I think our nurses will be continuing to save our people, save our country from so that it goes as early as possible, because we can't afford so much of lockdowns and so many, economy going down, and our family have no money, and private hospitals, they are just paying 10, 12,000 rupees paid to them, and how can they survive? How can they take good diet? How can many difficulties are there which cannot be explained now. But what I want to say is that people should respect our services. We are not demanding anything from them. We are not asking them to give us a big applause, but at least they should not misbehave with us. You know what their misbehavior, you get our
Okay,
house
no,
and then
I understand. Yes, Mrs. Khurana, I'm really sorry that there are people out there who are actually misbehaving with our healthcare workers, with our nurses. We got an instance where, nurses were misbehaved with, molested in the national capital because societies had an issue with them coming and going, and far too many of these instances have taken place. I just want to take our viewers through some of these examples. In Uttar Pradesh's Gonda, an ASHA worker was verbally abused and manhandled by 5 people. She had gone to the area to collect data and make a list of people who had recently traveled from other states or had traveled abroad. Now, people don't understand. She was there to find out if there is anybody who's hiding travel history, if there is anybody who may have recently come in contact with someone who needs to be secluded and isolated right now. She was there to help these people. Instead, she got abused and she got targeted. I will give you one more example. And this is the example coming in from Ujjain. In Madhya Pradesh's Ujjain, a medical team that was similarly carrying out a survey was abused and threatened by the residents. And the residents say, we are not going to share the information with you. Now, viewers, I want to make this extremely clear. These people are on our side. They are there to collect your information, not for some conspiracy plan. There is no plot. The only idea is to help you and I. The only idea is to ensure that we remain safe. And if there's anybody around us who may have the possibility of being exposed to infection, they identify this person and take this person away. Now, Mrs. Khurana, before I go to our other panelists, if I can just ask you to reiterate what your demand is. What would you like from the government at this point of time as our nurses go out there, spend 10 hours, 12 hours, 14 hours in the hospitals, risking their own lives for us?
We want that they should provide us proper PPE and the proper coordination, a single room accommodation with attached bathrooms, so that we don't spread that corona. If you are somewhere, they said we will put in the hospital, common bathroom, that is not good to us. So we have demanded at least care for the caretakers. That is our demand. Give them proper PPE, give them proper food, give them proper place to stay, so they can serve better, so that as early as this coronavirus from our country. That is our demand to the government. And I think is trying to do many things. I hope that so that even our lives are saved, and when we are in community, we may not infect other people. That is our main that go in the public, we may many people which we don't want.
Okay, if I can just go across to Dr. Kaushik, he's a Joint Secretary and Spokesperson for FORDA, which is another of the a medical association, and FORDA in fact has written to the government and the Prime Minister seeking their help at this point of time and seeking protection. Dr. Kaushik, repeatedly this issue has come about, but there doesn't seem to be a change on ground. Why do you think that is?
Yeah, good evening. Yeah, this is a very hard fact that despite so many court requests to the government as well as the authorities and request to the general public that such instances get very demotivating and depressing. But still, such instances are happening because many of that has been quoted, like resident doctors are going to find out cases and to training in different are being assaulted. So it is depressing. Strict action taken against such culprits so that next time such do not happen. Which event doctors don't feel demotivating while having to fight against this social care problem.
Okay, Dr. Kaushik, do you agree with what Mrs. Khurana is also saying? In some parts, it is happening that separate accommodation has been provided. Now, of course, that's also a very difficult thing to do, to stay away from your families and your loved ones for so long. But do you think that's perhaps the need of the hour? That in every city and every hospital, the medical fraternity is given, separate accommodation and protection.
Yes, ma'am. Regarding this, I would like to clarify that the demand, the request of accommodation is very genuine because once we are working with the patients who are affected for corona, then there is a high chance, and we even don't get till the time we get this thing needs to be understood that we are not getting any symptoms at the same time. If we are going at our homes, we might even be the cause of transmission of the community. So that is I think a good idea that if people working in the ward, they are provided accommodation, some kind of accommodation which prevents further transmission. So that is the demand that if somebody is making, that is a genuine demand. Best you can say whatever is the need of the society, it is for the good of the, and it becomes very difficult. Slowly it becomes difficult if you do not meet your commitment for stretch of 21 days. It is very emotional and very hard thing to do. But people are doing it because of for the good of society. So yes, if some kind of provision, they are really happy.
Yes, I understand. And again, I mean, I can't say this enough, but thank you for what you and your entire fraternity are doing, an extremely difficult thing to do. The nurses and the doctors and the paramedics and the entire support staff, and to do it day in, day out. It's not a matter of one day or even 1 week. This is going to perhaps even, get more difficult from here on. I want to remind our viewers, this is what Prime Minister Modi said on 25th of March. In this hour of crisis, doctors and nurses in white clothes in hospitals are the form of God. They are saving us by putting themselves in danger. If you see them being treated badly, then you should go there and explain to the people. Doctors, nurses, medical staff save lives, and we can never repay their debt. Now, Mrs. Khurana, if I can come back to you, what's happening right now? Is that also very new and unprecedented, or is there a larger issue of medical fraternity being constantly targeted by patients and their families?
Yeah, I think the medical fraternity is constantly targeted by the patients and their family when they come to the emergency. Sometimes with a very serious case and the patient dies, or they have problems, so they leave everything and then starting doctors and staff standing there. So this is a very bad, and I think last year only the IMA has Dr. Harshwardhan that the law should be made that the persons who do such things they should be punished. It should be not acceptable. But I think it was not passed in the parliament. I don't know that bill was made but not passed. I wish that that type of bill should be passed so that medical fraternity who's serving the people, who's saving the life, many lives have been saved when the patient come in the right time in the hospital, and otherwise also so many surgeries, so many, can't count what we people are doing. I think the legal protection is not sufficient for us, and the other problem which we are facing, I it should end someday when our people recognize. I think the public has to recognize our services. Then only they only recognize when they are in trouble. Otherwise, they are not bothered. That that is the main thing. I think that for our people, the law is required to sort out all these problems.
Well, the fact that there have been warnings and there are rules and regulations, but they still don't get followed and people get targeted like that, healthcare workers, doctors get targeted like this, is really unfortunate. Now, before I move on, very quickly, Dr. Kaushik, to you one more time, if there is a message that you have for people, entire country came together twice, on two different Sundays, and the idea was to show our support and express our gratitude to all of you. But of course, there are instances on ground where this is not happening. If you had a message to the people and you could use this platform to make them understand, what would that be?
I really appreciate and at the same time thank of the society and who have gathered onto occasions to like maybe thank us, maybe motivate us. It has been very motivating those 10 minutes. They have really just a long time. At the same time, the circumstances which are coming across and reporting that residents and doctors and workers are being assaulted, abused, they are very motivated. And such instances have been coming in the past. But during this crisis, this moment of crisis in which all of the nation is in trouble, and actually there's a sense of insecurity in at this point of time, it becomes very demotivating, depressed, very sad. I do not have words to explain. We are amongst you. We are a part of. We need your support, and we are always there to it every time. At the same time, that in this crisis situation, we show patience, behave maturely, and stand in stand in support of the community as well as people who are doing essential service.
All right. Yes. Yes, Dr. Kaushik and Mrs. Khurana, thank you so much for joining us. I really appreciate what everybody from your community is doing. I can only hope that what you have come and shared with us here today and the instances that we have highlighted wakes up the people of this country, those ignorant people who are only thinking about themselves right now and not coming together as a society to support you all in this big battle. You are our frontline warriors, and I know the government is doing quite a bit. The governments also need to do a lot more in terms of providing protective gear to our frontline warriors in terms of providing them accommodation and all the support services. But keep this in mind, viewers, each one of those people, each one of the doctors and nurses and the paramedic staff, the ambulance staff, the ambulance drivers, everybody else in the hospital that keeps the system going, all of those people in the labs today who are testing day in day out to see who has the infection and who doesn't have the infection. And I'm not just talking about those who are dealing with the COVID patients, but every single other healthcare worker who's stepping out today to do their job so you can be safe tomorrow, so the country can defeat coronavirus. They too have a family. They too have children and loved ones and husbands and wives and parents who are constantly worried about them, just like you are about your family members. So spare a thought for them and be a little empathetic, a little human and humane towards them. That's all I want to say. Thank you so much, Dr. Kaushik and Mrs. Khurana, for what you're doing and for joining us here on Mirror Now this evening. I want to move on to the second conversation. The second conversation now puts the spotlight on the lockdown. Now, as the lockdown deadline for 3 weeks comes closer, we've just got 5 more days to go. There are hectic discussions going on about what should be the next course of action. But there are 2 very interesting trends, viewers, that is coming out right now. Trend number 1 is that some of the states have already begun to take decisions or are on their way to take decisions of what has to be done, irrespective of what the center may decide this weekend or before 14th April. For example, the state of Odisha has already decided that the lockdown will continue till April 30th. So the state of Odisha, irrespective of what the center decides, the lockdown will continue. For example, the Telangana Chief Minister has already very clearly said that he wants the lockdown to continue. Despite the steps that they have taken, they don't believe that on April 14 the lockdown should be lifted. And many other states are taking a clearer stand. Most of them are in the favor of an extension. Some believe maybe it should be left to the individual state governments to decide how it should be done. If it should be area specific or it should be a blanket regulation for the entire country. But here is the second trend, and this is the more important one. This trend shows us that we've got more and more areas, whether they are containment zones or sealed premises or areas where entry and exit has been completely banned. There are more and more of such areas across the country right now. Uttar Pradesh yesterday announced 15 districts where in certain pockets there will be a complete shutdown. In the city of Mumbai, there are many zones where there is a complete shutdown. The fruits and vegetable shops are also not allowed to open. The APMC market has actually been shut down till further notice, will not function right now. Anything that needs to be done to ensure that social distancing is maintained is being done. Now in such places, they have decided to go for door-to-door delivery. So over the next 90 minutes, I am going to focus on some of the crucial states and what is being done there and how it's being done. We'll start with the state of Maharashtra. Let's give you the example of what is happening in Mumbai. And I want to tell you this because, for example, the Dharavi slum has now seen multiple cases. Over 6 cases have emerged from there. It is a population of 8 lakh people, about 2.2 kilometers area, and just about 1 toilet every 1400 residents. This is how crowded Dharavi slum is. Now imagine if the infection begins to spread, what kind of a healthcare challenge it will be. Which is why authorities are getting extremely precautious right now and shutting down and clamping down as much as they can. People are not allowed to move out. They are specifically focusing on buildings, shutting down those buildings. But what's the way forward? And in overall, the question tonight is, in this decisive week, will we be able to defeat coronavirus? Or are we then staring at a longer period of a stricter lockdown? That's the big question. Now, we will have a special guest joining us right now on behalf of Maharashtra to tell us how Maharashtra is dealing with it. We'll also go across to Disha, who's joining us live from Mumbai to get us the latest updates. But let me tell you what's been happening. Of the 5,865 cases in the country, Maharashtra essentially is still topping the list. In Dharavi today, Disha, a third death was reported. So how is Mumbai dealing with this situation? There were reports today in many parts that shops are completely closed and absolutely no movement is allowed. What's the plan?
Is the question for me?
Okay, I don't think Disha is right now with us, but I believe Mr. Aslam Sheikh is with us now. Okay, Mr. Aslam Sheikh, thank you so much for joining us. Good evening, and thank you for joining us right now. I appreciate you speaking to Mirror now again. Mr. Aslam Sheikh, the biggest challenge for Mumbai and some other parts of Maharashtra right now is how to deal with the crowded clusters and slum areas. Can you give us an insight into the strategy? In many parts today, we saw complete shutdown, including shops for essential goods.
See, if you go to see in Maharashtra, the Mumbai is a crucial part. And we have been taking steps every third day, whatever best we can do for Mumbai. So today we have taken a decision, tomorrow onwards, all the vegetable markets Mumbai will be shut. Simultaneously, we are going to do on all the hotspot area so that nobody is allowed to come inside and go out. And thereafter, every day, trying to go into each and every area, house to house, check every person staying over there. Pricing will be done the way you want. It's limited toilets in that particular area, coupled with another infection, which we use it once in that can last for days. And this particular area will be filtered by people, which will have announcing as well as if any try to violate this curfew, he will be deemed very hard. And for Mumbai, we have also started a call center.
Okay, let me begin.
Go
ahead, yes.
We have started a call center, and with the call center, we are receiving thousands of calls, and we are reaching to the people, and we are getting their testing done. As well as we have started a testing center where they can sit in the car across that booth, which is 100% sanitized, 100% foolproof, where the transmission cannot go into, and we can have this completely testing done in 2 minutes.
Mr. Aslam Sheikh, if I can actually ask you more about this helpline, where can we find the details? What kind of problems can people call with? Is there a response time that you have slotted?
No, this is working 24 hours, and it's on the Mahanagar portal. There are more than 2,000 people walking through 24 hours. And if you have any other problem regarding health issue also, that can also contact and get to it that doctors, if needed, send them to their societies also. And approximately,
let's talk a little bit more about the hotspots if we can. Yes, so there are many hotspots in the state of Maharashtra, especially in the city of Mumbai. I wanted to understand if everybody will get tested in these hotspots, if they're going to be allowed to step out at all. Will you provide door-to-door delivery in all the hotspots? If you can give us more details.
See, we already have more than 20 hotspots in Mumbai itself, and we are going to put a curfew in this particular area. Simultaneously, each and every house need to check, and we are going to test each and every house nearby. We have another team deputed who is going to look into this particular case where all he has been in last 3 days, which all relatives have met. So simultaneously, we can cover the virus over there and there. We have enough space for isolation also and for quarantine.
Um, okay, okay, Mr. Sheikh. We've also got Shiv Sena MP, Mr. Chevale, who suggested that everybody in Dharavi should be tested. Do you have a view on if that is possible, if the government can explore that?
See, right now we are targeting the hotspot and we are covering more than 300 to 400 houses nearby. So that particular thing, it's go to say it's a very huge slum, and right now we don't think so. It is necessary to test each and every person simultaneously. That particular 300 to 400 houses we are testing, and we are removing the history where all he has been visited, all his relatives, and everything we are monitoring very minorly. So I think so. This will be good enough, and if needed, we can go to more extent also later on.
We have enough testing kits and protective gear for health workers to do this kind of large scale test?
Sufficient kits are available with Mumbai Mahanagarpalika as well as the government also. And we are the first state to remove the direction all the hospitals to have a proper kits for all the nurses and all the doctors. Only the circular has been given to all of Maharashtra. They have to see that all the requirement necessary kits and whatever necessary sanitizer or whatever is needed in each and every hospital, it will be a mandatory to maintain all these things in each and every.
Mr. Aslam Sheikh, if I can ask you, is there a thought process within the government on what should happen after 14th of April? What is the majority view? Should the lockdown extend for the entire state, or would you want it only in specific areas?
See, we are still monitoring and we are going to wait till 12. There are certain districts in Maharashtra where you don't have a single patient out. So by locking all these districts, not make any difference. So we see like if certain districts completely under control, some relief can be given to those districts. Otherwise, if you go to Mumbai, definitely we are looking into it, and if needed, we are going to extend this.
Oh, okay. Let me ask you this question. How long do you think we can continue in this way, and what would be the biggest challenge? Maintaining essential supplies or providing healthcare to people in an extended lockdown period?
See, we cannot give any particular timing. Nobody can give, the whole world is fighting against it. And so far, none of the country can say we have where we have controlled this particular world. So as far as the first priority of the government is to save the life, we can go to any extent to save them. If the lockdown has to be extended, we'll be extending it. And so far, we have already issued an order to all the ration shop, that all the ration card holders, they get rations. And about this hotspot area, we're looking at the necessary, whatever essential is needed in this particular locality will be dealt, and we see that officer is being deputed. So whatever necessary requirement in this particular area, we will also see.
Okay, Mr. Aslam Sheikh, before I let you go, I don't know if you are aware of this or it's come under the notice of the government, but there are many dialysis centers in Mumbai today that have been shut. The big ones are completely shut and non-functional. It's obviously become a huge problem because for those having kidney trouble, dialysis is extremely essential. Can the government take any action against such hospitals or ensure that at least basic services are available for the patients?
No, this is a very serious issue which has come over. And about we definitely, I know each and every hospital has gone through. There was some positive case of dialysis, corona positive cases were there, and there were some nurses also who were also affected. So we cannot take a risk of continuing it at this stage. So we had to quarantine some nurses and all. So one of the hospital like Milton, which used to have more than 250 patients, has started again, and simultaneously we have shifted some of the dialysis patients to nearby hospital, government hospital, and Mahanagar Palika hospital. We are monitoring it very closely, and I think so in a couple of days, all the dialysis centers will work.
All right. We hope that these problems get resolved soon. And thank you so much for sharing the time and talking to us and giving us an insight into how the Maharashtra government intends to deal with the current situation. Thank you, Aslam Shaikh, for joining us right now. Let me also see if I can quickly go across to Disha, who's been reporting through the day for us and going from one part to the other. Disha, let's begin with Dharavi itself, where now we've seen more cases come out. On ground, what was the situation today?
Well, Tanvi, if we particularly talk about Dharavi, right now the positive cases stands at 17, including 3 deaths. Today, in fact, we have seen 3 more new positive cases from Dharavi itself. And if we talk about the entire area, at least there are 7 containment zones, which essentially means these are highly affected areas where over 3,500 people are home quarantined as we speak. Over 80 high-risk patients have been identified till date, and now the BMC plans to extend screening of people on the ground level, which essentially means now all the 8 lakh population staying in Dharavi will be screened starting tomorrow. Door-to-door screening will take place. The number of doctors will also go up, and this is only because it's a highly densely populated area, Tanvi, as we all know. It's spread across 2 kilometers. There are stalls, there are slums, and in fact, there are SRA buildings, and most of them, of course, have been highly affected. And today, considering a high number of cases are there in Dharavi, PMC in particularly took this decision of shutting down specific 10 roads in the area of Dharavi, like the Dharavi Main Road, the Dharavi Cross Road, Matuga Labour Camp, because all of these areas, of course, the essentials, the vegetable markets were on, but starting today, due to overcrowding, that also has been completely shut down. So essentially means all these 10 specific areas in Dharavi have been completely sealed. People will get essentials at their doorsteps as in when they require.
Okay, that's as far as Dharavi is concerned, Disha. But today, we saw reports emerge from various parts. Of course, in Dharavi, there were 10 roads that had been completely shut down and no activity allowed there at all. But in other parts of Mumbai as well, to the point that we are now given to understand that perhaps APMC market will also be shut. What's the larger strategy so that people know this and are not simply wondering why they're not able to buy vegetables in their neighborhood?
Well, overcrowding is the only issue that the BMC is taking at this point in time. Can we remember, even though there are 381 containment zones in the city of Mumbai, in all of these areas, specifically the vegetable markets and the fruit markets were open. But the BMC did observe in the last couple of days that there was overcrowding outside supermarkets, at the vegetable markets, and that is why, to contain the spread of the virus, these certain restrictions are needed on the ground level. So today, for instance, we saw, apart from Dharavi, there is another L ward entirely being sealed for that matter, where vegetable markets also won't be operational. And these are specific areas like I'm saying Kurla, Pawai, Chunabati, Ghatkopar. All of these areas now, the vegetable markets and fruit markets won't be operational till the time lockdown continues. But the BMC says that essentials will be given to them as in when they require. So there will be no dearth as far as the essential is concerned. And if you talk about the larger picture, the APMC market, again, that will be shut starting from Saturday is what we understand till the lockdown, at least for 3 to 4 days is what the APMC market officials are telling us. And this is to avoid overcrowding again. Because remember, Tanvi, APMC is one such market where everyone, including the traders, the workers, they have to work in very close proximity to each other. And now with the cases actually rising, not only in Mumbai, but Navi Mumbai as well, the BMC and the officials are taking some strict lockdown measures on the ground level.
Okay, so some strict, measures will be taken at the ground level. That's the word that's coming in from the Mumbai civic body BMC. Disha, thanks so much for bringing us that update as far as Maharashtra is concerned. Viewers, like I told you, we are counting it down to the end of this 3-week lockdown period, but that doesn't mean that the life will significantly perhaps change for us after that, as most states are of the view that the lockdown should continue in one way or the other. Now, in what sense and to what extent is of course what we need to see, but some of the states like Odisha have already decided to extend it till April 30th. Then there are other states like Telangana who said that yes, the lockdown must continue and the center should take that decision. Then there are states like Karnataka where their own internal recommendation seems to be that the lockdown should continue, although not to the extent that we've seen right now. But in every state, they are getting stricter in areas where multiple cases have emerged. So while there may be relief in parts where there are not too many cases of coronavirus, in specific hot zones, in containment zones and sealed premises, the governments are getting stricter about implementing the lockdown. Unfortunately, viewers, that's not enough, because we've still got some violators, some citizens in our country who just won't learn. 2 weeks into this lockdown, and violations continue to be reported from various parts of the country. And let me give you some examples. Now, this is in Hubli. People were seen gathering in large numbers and buying essentials. It was as if there is no lockdown at all in the city of Hubli in Karnataka. And people were just about going their normal day. There was enough crowd on the streets. On the other hand, in Rohtak in Haryana, a truck was actually caught transporting liquor. So the lawbreakers continue to find their ways, the law violators continue to find their ways to actually keep their own illegal business going. This truck, viewers, had 470 cartons of liquor in Rohtak district of Haryana. According to the police, the truck was carrying liquor buried and covered by sacks of vegetables. A case has now been registered and the driver is being investigated. But there have been multiple cases that have emerged from Karnataka. So the violators just won't learn is the big focus right now. And Shrija is joining me live from Bengaluru on it, because there have been multiple instances in Karnataka. Shrija, let's begin with what happened in Hubli. Is there no lockdown there?
Well, that's right. Tanvi, in fact, we are looking at the country at this point in time, but how talking about Karnataka, there are some of the who are continuing to violate such norms, because one particular district that we're talking about here is Hubli in Karnataka, where we saw just this morning people were thronging markets to go purchase essential commodities, and we witnessed something we are not supposed to witness on a lockdown order. But what we saw today was where people had crowded the streets. We could see in fact traffic. Now that is not something that we usually witness. This is one particular district. The second district that we saw where people threw caution to the wind was Mandya. Mandya district, where we saw people once again going to the market. There was no social distancing being maintained. We did not really find law and order police at that point. And remember, of course, the Karnataka government had issued certain advisory, especially to the Bangalore police, to ensure that people do not crowd at a particular point. But the situation is very different as far as the concerned. And also another instance what we saw in Dharwad district of Karnataka, where we see that there was several cases were reported to do with fake passes. Maximum over 100 retailers had duplicated their passes. They had thronged this particular APMC market. So it was only this morning when suburban police of Dharwad the passes they had find something. This the only reason there were over 100 people in that particular premises as far as APMC market is concerned. So they began in fact taking the passes. They were asking them what exactly did they get. That is when they found out that the APMC market president had forged the signature of the police and had issued over 100 passes to the retailer, and as well as welcome passes were also issued.
Okay. All right, Shrija, apart from, what the violators have been doing, let's also talk about the task force recommendations. Now, we got some details yesterday as well. The Karnataka task force has already submitted its recommendations to the Karnataka government. In fact, today we understand there was a cabinet meeting as well in the state. What seems to be Karnataka's thought process about the lockdown? What do they want?
Well, that's right. And in fact, there is this task force which has been set up here in Karnataka, the COVID-19 task force. Now, this is set up only to analyze the entire COVID-19 situation here in the state of Karnataka. But for recommendations presented by the COVID-19 task force state committee, we see they're talking about public transport should not be allowed, medical services will have to be shut, and only especially restrictions, lockdown restrictions should be relaxed in certain areas where less number of coronavirus positive cases have been reported. Also, they are talking about they have identified some of the hotspots here in Karnataka. Now, those are the hotspots where they're looking at an extension of lockdown. So these are the kind of things put forth before the Minister of Karnataka, including which talks about educational institutions will have to be continuously shut for a couple of weeks or so until the situation gets back to normal. So we see that this morning, just this morning, where the cabinet meeting had a and out of that, what we understand is that Chief Minister B.S. Yediyurappa even briefed the media by saying that he will be putting forth recommendations and also a Prime Minister of India, Narendra Modi, about what's the situation as far as coronavirus and depending on that, the decision will be taken. Now, as far as from the Chief Minister says, the office, what we think is that the decision will be taken tomorrow, whether or not Karnataka will have to extend the lockdown.
All right, Shrija. Thanks so much for joining us and bringing us that update from the state of Karnataka. We will wait and watch what happens next. All of this will culminate into a big meeting that the Prime Minister will have with the Chief Ministers in the coming days, and then the big decision on what needs to be done post April 14th. One thing is very clear, viewers, we are not going back to the normal life we had about a month ago. That's absolutely not happening. What kind of restrictions and lockdown will we see is what needs to be watched out for. I'm going to take a very short break right now. Lots more on the other side. We've put the spotlight on states like Uttar Pradesh and Madhya Pradesh, and then also the national capital, and talk about how they're dealing with the pandemic in these states. Stay with me.